Okay friends, so welcome back in another video tutorial from microbiology with Shagnik. So in this video tutorial we will going to discuss about the last mode of mechanism by which bacteria are destroyed by antibiotics, that is the protein synthesis inhibitor. Okay, first of all I want to told you that in case of ribosome, the there have one large subunit 50s large subunit, another one is the 30s subunit. Okay, so there are a couple of inhibitors or couple of antibiotics present which especially targets 50s subunit, and there are also couple of antibiotic present 30s whose especially attacks 30s subunit. So I have decided to divide that entire topic into two videos, where in one video I will going to discuss about all the antibiotics present in 50s subunit inhibitors. Okay, and in the second video I will going to discuss about all the antibiotics who are present as 30s subunit inhibitors. Okay, so this video is for 50s subunit inhibitors. Okay, antibiotics who are especially targets 50s subunit. So in this flashcard all the antibiotics written in blue pen are all of 50s subunit. Okay, and all those are written in black are 30s subunit inhibitors. So let's first discover about a common antibiotic. I hope you have heard the name of that first earlier, that is chloramphenicol. So chloramphenicol is a synthetic antibiotic. It blocks peptidyl transferase. This is an enzyme which is involved in peptide bond formation, and as a result it facilitates protein synthesis inhibition. Okay, so here BS means our bactericidal and BC means in BS means bacteriostatic and BC means bactericidal. Okay, so chloramphenicol is usually a bacteriostatic inhibitor. Okay, but under such condition, for example, when you are using using chloramphenicol at a type of microorganism who are susceptible for chloramphenicol, then the chloramphenicol may act as a bactericidal. And again, when you are using a higher concentration of chloramphenicol against a too small amount of bacteria, then under such condition chloramphenicol can also act as a bactericidal, but in general they are acting as a bacteriostatic. Okay, and there are some kind of side effect also present when you are using a chloramphenicol into a patient. For example, aplastic anemia, and it can also inhibit mitochondrial protein synthesis, and that is not a good news for us, right? So that is all about chloramphenicol. So chloramphenicol is a synthetic drug. It attacks 50s ribosomal subunit and it inhibits peptidyl transferase, and that is how they inhibit peptide bond formation, and in turn which inhibits protein synthesis, right? So it is a bacteriostatic inhibitor. Okay, but sometimes they becomes bactericidal when we are using higher concentration of the antibiotic, or when we are treating or when we are using chloramphenicol against a bacteria who are susceptible to this. Okay, and two side effect which is important to know for you: one is aplastic anemia and another one is it can inhibit mitochondrial protein synthesis. Okay, so that's all for chloramphenicol. Now let's move to the second type of antibiotic, that is macrolides. So this kind of antibiotics is again a 50s ribosomal subunit inhibitor, and it attacks the Saccharopolyspora. It isolated from Saccharopolyspora erythrea. Okay, it is a kind of yeast from which we are isolating macrolides. Okay, so now let's try to focus. Macrolides. These macrolides will bind with the P site of the 50s ribosomal subunit reversibly. Okay, that means macrolide will bind here, and it will inhibit the further elongation of the peptide chain, because Remember, tRNA will come and it will react with those codon and attach a appropriate amino acid on the basis of the codon present, right? That is the idea. So if macrolide is present here, it will prevent that elongation. Okay, so it elongates, it prevents the elongation of the peptide chain and also blocks translocation. That is the idea of macrolide. So macrolide will reversibly bind with the P site of the 50S ribosomal subunit and it will inhibit the elongation of the peptide chain and also blocks translocation. Okay, so examples are erythromycin, dithromycin, azithromycin, clarithromycin. Okay, so we can use macrolide whenever we are treating pneumonia which is because of some Legionella or Mycoplasma infection. We can also use for treating gastrointestinal ulcer causing Helicobacter pylori. We can also use for treating certain gastrointestinal tract infection caused by Campylobacter and also some sexually transmitted disease, for example chlamydia and gonorrhea. Okay, so macrolide is a kind of antibiotic which is isolated from what? Saccharopolyspora erythrea. Okay, so it is again bacteriostatic and depending on some certain condition that is exactly equal to the condition that I have mentioned in case of our chloramphenicol, that is if you are using it at higher concentration and if you are using it against a microorganism who are susceptible to this, under such condition macrolide can act as a bactericidal, otherwise not. Okay, so this macrolide will inhibit the peptide chain elongation by binding with the P site of the 50S ribosomal subunit reversibly. Okay, it can inhibit pneumonia causing Legionella and Mycoplasma, and it can also destroy Helicobacter pylori. It can also prevent certain gastrointestinal tract infection caused by Campylobacter and also some sexually transmitted disease, for example chlamydia, gonorrhea. Examples are erythromycin, azithromycin, dithromycin, clarithromycin. Okay, now let's come to the another kind of antibiotic, that is lincosamide, whose mode of action is quite similar to our macrolides. Okay, so it will bind to the 50S subunit and it will block the elongation. Okay, so it is again semisynthetic and it is derived from actinomyces source. Lindomycin and lincomycin are for example, and they are gram positive, and some anaerobes are especially treated or especially attacked by lincosamide. Okay, so lincosamide are what? Lincosamide are semi-synthetic antibiotic, mind it very carefully, and also they are isolated from actinomyces source. Okay, and you can use lincomycin for any kind of gram positive or some anaerobic treatment. Okay, and it will bind with the 50S subunit and it will block the elongation. Okay, so that was the idea of lincomycin. Now the last one for today's class, that is streptogramine. Streptogramine can be divided into two parts. One is non-peptides, another one is cyclic peptides. Okay, so let's talk about the non-peptides first. The example of non-peptide streptogramine are dalfopristin. Okay, it will distort the ribosome and inhibit tRNA binding. Okay, and if tRNA cannot bind with the peptide, cannot bind with the mRNA, can peptide bond formation and ultimately peptide synthesis and then protein synthesis occur? No, because as tRNA cannot bind, it cannot attach amino acid on the basis of the codon that is present on the mRNA, right? So that's how the blocking is done. Again, another kind of antibiotics are cyclic peptides, for example quinipristin. Okay, it will block translocation. So if you are using non-peptide and cyclic peptides together, so they can show a synergistic effect. Okay, so that was the idea of various kind of 50S ribosomal subunit inhibitor. So first we have seen about the clarithromycin, sorry not clarithromycin, extremely sorry. First we have seen about the chloramphenicol. Okay, so chloramphenicol attacks 50S ribosomal subunit and it is blocking the peptidyl transferase enzyme, okay, which is involved in peptide bond formation, and as a result protein synthesis is inhibited. For example, it is a bacteriostatic inhibitor, and sometimes we are also using it as a bactericidal. For this we have to use our chloramphenicol against a highly susceptible microorganism, right? And there are various kind of side effects too. For example, aplastic anemia, and it also have the capability to cause mitochondrial protein synthesis inhibitor, which can act as a side effect. So that is all about chloramphenicol. Then we have also discussed about macrolides. These macrolides will bind with the P site of the 50S ribosomal subunit reversibly, and that's how they prevent elongation of the peptide chain, and as a result protein synthesis is inhibited. Okay, so macrolides is isolated from Saccharopolyspora erythrea. Okay, erythromycin, azithromycin, clarithromycin, dithromycin are the example of macrolides. Okay, so it is again bacteriostatic inhibitors and bactericidal in some cases. Okay, so we can use this for sexually transmitted disease treatment caused by our chlamydia along with gonorrhea, and again if we can also use to treat it certain kind of pneumonia, for example pneumonia caused by Legionella along with our mycoplasma, okay, and certain gastrointestinal tract infection also caused by Campylobacter. So that is the all about macrolides. Then we have discussed about lincosamide. This lincosamide is a semi-synthetic antibiotic. Lindomycin and lincomycin are the example of lincosamide, and this lincomycin is specially isolated from actinomyces source, and it have the ability to attack 50S ribosomal subunit and block elongation. Okay, now so after lindomycin we have discussed about streptogramine. Okay, so lincomycin is also, lincosamide is also used for gram positive and some anaerobic bacteria treatment. So streptogramine we have last discussed, that is the non-peptide and cyclic peptide. This is the two kind of streptogramine available. The example of non-peptide is dalfopristin, which simply distorts the ribosome and prevent tRNA binding, and the example of cyclic peptide is quinupristin, which block translocation. Okay, and if we are using non-peptide and cyclic peptide together, then it may exert a synergistic effect. Okay, so that's how various kind of 50S subunit inhibitor we have discussed. First we have discussed about chloramphenicol, then we have discussed about our macrolides, then we have discussed about lincosamide, and at last we have discussed about streptogramine. Okay, so I hope this video will be helpful to you to understand about the various kind of antibiotic we have discussed that are specially targeting this portion. So in next video we will going to discuss about antibiotic that will going to target this part. Okay, so till then friends, bye bye, and thank you for listening to this class.